We are going to talk about arthritis, osteoarthritis. Gregor and I are going to run through the definition of osteoarthritis and the challenges we have in diagnosis. We will introduce some of the problems we have in diagnosis and the importance of accurate diagnosis in the osteoarthritis. So one of the most important things we have to remember is that osteoarthritis is very, very common. It affects at least 1 in 5 dogs, possibly more. We will see it more commonly in older dogs, but it can affect dogs of any age. We must remember it's usually a disease that's the end point of a number of other conditions. It's a common pathway of the failing joint. So we can see it from joint instability, such as cruciate ligament disease. We can see it following trauma, a fall or a fracture. We can see it as a primary disease as well, but usually it's a secondary condition to other joint diseases. And we need to remember as well that it's not one single entity. It affects all the different tissues of the joint, the synovium, the lining of the joint, ligaments that connect the bones together, bone itself, particularly subchondral bone, and cartilage. And because it affects all these tissues, sometimes in different magnitudes, the progression of it is unpredictable. And we can also have it affected by other diseases, particularly obesity. So remember, osteoarthritis is more than just a sore joint. Because of this wide variety of presentations, we have to be very, very careful about how we approach a diagnosis. Because when we look at a patient that has osteoarthritis, or we think has osteoarthritis, we need to bear in mind that the manifestations of osteoarthritis may be more widespread than just having a painful joint. So we can see, for example, muscle loss in dogs that are not using the leg. We might find if dogs have a chronic lameness, they might develop spinal pain because of the way they're walking. They might develop sore muscles, stiff muscles. They might develop tendon disease. They may develop behavioral changes if they anticipate discomfort. And if they're walking abnormally on other limbs, they may then exacerbate disease in these other limbs or actually develop joint disease as well. So it's very, very important that we identify not just the presence of osteoarthritis, but all the sites of disease in the dog, not just in other joints, but other muscles, ligaments, tendons, bones. Everywhere in the dog, we have to assess what is the disease, osteoarthritis, and what are the effects of the disease. So we are very, very keen on pressing the idea that if we can get an early diagnosis, if we can make clients aware that the patient, their dog or cat has a problem, then we can develop a strategy to help prevent or manage these other concomitant diseases. So in terms of a diagnosis, it's very, very important that we recognize there are 2 components to this. Yes, as a vet, we will assess a dog who's presented with lameness or discomfort, but the client has to recognize their dog has a problem in the first place. So it's very, very important that we educate owners and give them an awareness of how the patient may present with early stage osteoarthritis. And this is a major challenge because very often when dogs are brought to a veterinary practice, the osteoarthritis will be a fairly advanced clinical stage. It will certainly be clinically apparent, but the dog may actually be presented not because of osteoarthritis, but for other comorbidities that perhaps have come on more acutely or cause more of a clinical presentation. So yes, we must explain to owners, particularly with young dogs who have joint disease or risk factors of having osteoarthritis, or older dogs at routine checkups, we need to emphasize what are the early signs of osteoarthritis? Things like stiffness or after exercise or rest, reluctance to climb stairs, slowing up in walks, for example, or behavioural changes. So a basic orthopedic examination at routine veterinary visits, such as vaccination, but we also, with technology, we're able to encourage clients to film their pets as often as possible. And if they have any concerns, they can send the film to us as vets, and we can look and help them with that. Or they can build up a reference of how the dog's moving, and actually subtle changes might be noticed year on year. So this can also be very, very useful, because clients will sometimes be confused as to the location of lameness, or if the dog turns up at your surgery full of adrenaline and excitement and perhaps doesn't show the lameness as overtly as the client might recommend. If they have a video, then it's quite easy for us to look at that. So a detailed orthopedic assessment is required, and it's very, very, very important that when we do our orthopedic assessment, we don't just jump straight to the leg that might be lame. It's very, very important we take a very, very detailed clinical history. It's very important that we go and watch the dog both moving at walk and trot, but also how the dog moves in the consultation room. And then we can go on and do our orthopedic examination. And it's very, very important, again, that we don't stop our orthopedic examination when we find a focus of pain. If the dog presents with a right fore lameness and you examine the dog and it has a sore elbow, you mustn't stop the orthopedic examination at the elbow, because the dog may have concurrent diseases, such as digital arthritis. It may have carpal laxity. They may have other issues that we need to assess thoroughly before we move on. So taking a history is very, very important. And actually, you can often get a huge amount of information as to not only where the problem might lie, but also how you might treat the dog by taking a detailed history. So the severity of the lameness, how lame is your dog? Is it lame all the time? Is it lame in the morning? Is it lame in the evening after exercise? And how has it changed? Is the dog getting rapidly more lame? If that's the case, then perhaps there might be something else causing a problem, like a muscle or tendon disease. Yes, it might be secondary to arthritis, but we have to be careful that we're not missing these conditions. Has the dog changed its behavior? Is it sleeping well at night, or is it restless? That might tell you that perhaps there's a bone pain or a joint infection or something to that ilk. We need to know, in the past, has the dog had a history of trauma? How long has the lameness been present? How did it start? And have they tried any treatments? Clients will often acquire medications now online and try things. It's quite important that we build up this clinical picture of the dog so we can get the best treatment for it. So we're often looking for fairly subtle elements of the history, particularly if we're looking for an early diagnosis where the client might not be aware that there's a problem. So looking at the dog moving is really, really important. Look at the dog sitting down. For example, this dog de Bordeaux in the first picture has a reluctance to flex the stifle, and that's a strong indication that there might be stifle disease, most commonly cruciate ligament disease in this particular breed. Look at the dog standing. Is it offloading one limb? Is it preferentially standing to one particular position? Is it adopting a abnormal position because it's uncomfortable? And then watch the dog move. And it's very, very important that we identify which limbs are affected, not the most affected limb, which may be fairly apparent, but is the dog changing its gait? Has it got a bilateral lameness, which is more apparent on one side, particularly common, for example, in a young dog with elbow dysplasia in both elbows? Then we're looking at each individual limb. Watch the dog walk past you in both directions. You stand at the side and look and see if there are any asymmetries. Is the stride length different? Is the dog using joints in a different way? And that actually can give you a very, very good idea of where the dog's discomfort might lie. And again, in large dogs that might be difficult to examine, in aggressive dogs that may not tolerate a good clinical examination, by carefully looking at the dog's gait, then you can get a very, very good idea of what clinically is causing the dog discomfort, which can then help you target the examination in a difficult patient. it can be challenging, particularly if the dog is uncomfortable on more than one limb. Electronic gait systems are perhaps becoming more available. Pressure mat analysis is quite useful, but we have to be very careful that when we use these, because it's actually quite challenging to interpret the results and get a good clinical picture from that. So challenges that we have in identifying lameness, there are many different ways that the client will perceive a lameness. So if we think very hypothetically about what might trigger a lameness, take a primary disease, a joint injury or a trauma or a ligament rupture such as cruciate ligament disease. Initially, that primary disease will contribute a lot to lameness, and the dog may develop an adaptation strategy to that, and the effect of the primary disease may wane over time. At some point, if this primary disease is severe enough, it might start the process of osteoarthritis, which is irreversible. Osteoarthritis may wax and wane in its clinical severity, but when we combine these two conditions in terms of their contribution to lameness, we see a graph showing a cumulative effect. Now, when we look at this, we're looking for triggers that the client might identify that there's a problem. So if the client is astute enough, they may consider a threshold where they perceive there to be a lameness. So in this particular example, when the primary disease happens, the client perceives the dog to develop lameness and remains above that threshold for the entire duration of both the primary disease and osteoarthritis, and they may come to you early on. But sometimes that threshold is not so apparent. So we might actually see that the client briefly is concerned about the effect of the primary disease, and then sometime later, months or perhaps years later, they may perceive the lameness being present, but probably more likely due to osteoarthritis. So clients can have different awarenesses or thresholds of what the actual level of lameness is a problem. But the other thing we have to be aware of too is that the rate of change can actually be a trigger for clients. So if the dog becomes acutely lame, the client will see a change from one day to the next and bring the dog in. So perhaps not an absolute threshold, but because there's been a change in gait over time, in a very short space of time, they might bring it in. But actually with osteoarthritis, the slow change may be less apparent. They might not perceive the lameness as being a particular problem, but other aspects of that dog's behavior, like reluctance to exercise or stiffness and rising, might be more of a trigger. So we have to bear in mind, when we're taking our history, that we need to tease all these different components of the potential lameness apart. And actually, with careful questioning, you can sometimes get clients to reappraise what they perceive as being a problem. We then want to do palpation. Palpation is not manipulation of the joint. Palpation is simply running your hands over the surface of the dog from its muzzle right down to its tail to see if there's anything abnormal. Muscle asymmetry is perhaps the most important thing you'll see, either disuse atrophy or sarcopenia or any change associated with disease. But you can also assess joint effusion, enlargement of lymph nodes, periarticular thickening, and heat in certain joint diseases. So it's a very easy way to get a feel for where the problem might lie. We then go through and manipulate every joint, and we're looking for, yes, discomfort and crepitus, all the things we normally look for, but also a decrease in range of motion and instability. And I can't emphasize enough that you need to look at every single joint in dogs. A very common presentation for me are dogs that have identified or dogs that have had identified osteoarthritis in upper limb, so stifle or hip or elbow or shoulder, when in fact what's causing the dog discomfort is osteoarthritis of one of its digits. It can be very painful, very uncomfortable, and very debilitating. And finally, I would strongly recommend that you just get into the habit of doing a very routine neurological assessment. Placement and positional reflexes, withdrawal reflexes are the most simple way to assess neurological function. So, as I say, diagnosis of osteoarthritis can be straightforward, particularly when the disease is advanced. But remember, we're not just trying to diagnose osteoarthritis. We're trying to assess the whole patient and assess all the different components that might be causing this particular patient discomfort. So this is an example where the dog has its hip extended and it yelps. And so we look at that and we go, well, the dog must have hip pain. Therefore, we can look and go an image of the hip. But actually, when you look at how the dog was being manipulated, when it had its hip extended, firstly, it had the leg taken off the ground. So it's bearing more weight on its right hind and its front legs. It also then will probably have to increase the torsional stability in its spine. So just by lifting this dog's leg, you're causing it to shift its weight to other limbs and increase muscle tension in its back. We then, when we extend the hip, we are not just extending the hip, we're probably putting some pressure on the lumbar spine. We're putting pressure on the intrinsic and extrinsic muscles of the hip. We're putting pressure on the muscles of the thigh, and we're moving the whole limb. So while you're tempted to say this is a dog that has hip pain, all we're saying is this dog is responding to extension of its hip. The differential diagnosis includes spinal pain, muscle disease, neurological disease, ligament tendon disease, and osteoarthritis. So we have to be careful not to overinterpret our exam. And then if we go back to this patient and we start to palpate its pectineus muscle, its iliopsoas muscle, its lumbar spinal muscle, we'll get a better picture of why that patient might have reacted in the way it did.
Today, I'd like to present you clinical metrology instruments. In veterinary medicine, for clinicians, it's very important to find equal, valid, precise, reliable, and accurate method measuring of the follow of chronic pain in dogs and cats. If you want to manage patients with chronic pain, you have to be able to assess it. That helps us to choose the optimal treatment method, surgical or conservative, and then to assess the treatment efficacy. In many cases, for that clinical metrology instruments are used, these are called also as questionnaires. There are some advantages of clinical metrology instruments. The first is the fact that it assesses natural behavior, natural environment during extended periods. The second advantage, we don't need any expensive and any specialized equipment. The first clinical metrology instrument which I'd like to present you is Liverpool Osteoarthritis in Dogs Questionnaire. Load was first validated to evaluate canine elbow arthritis in 2009, but now it is one of the most popular questionnaires for osteoarthritis assessment. On the right side of the slide, I presented two kinds of forms for the first initial visit and for the next subsequent visits. There are two versions of the questionnaire, a printed version and an electronic version. During the follow-up visit, the client should not see the previous responses or previous scores. The owners should complete the appropriate forms and assess the dogs in three domains: background, lifestyle, and mobility. The mobility domain consists of 13 items, questions on from 0 to 4 simple descriptive scale, where score goes up from left to the right, and where 0 represents a healthy animal and 4 represents severe diseases. On the bottom in the right corner is generated the final score from 0 to 52. How to interpret the load score? The final score we put on the appropriate place of the chart, which can we see in the middle of the slide, and it allows us to determine the severity of osteoarthritis from mild to extreme. This questionnaire can be used by practitioners for choosing the treatment method and for clinical monitoring of osteoarthritis. Load score is recommendation only. Each patient should be examined by a veterinarian for the confirmation of arthritis. And now I'd like to say you shortly about other clinical methodology instruments. And the first is Helsinki Chronic Pain Index, HHPI. It has been used to assess response to nutritional therapy for osteoarthritis in dogs. The second one is Canine Brief Pain Inventory, CBPI, and it was adapted from Human Brief Pain Index and was validated for canine osteoarthritis and for osteosarcoma. Owners should to assess 11 domains: pain severity, functional impairment, and quality of life in last 7 days. The next is Clinical Orthopedic Disability Index, client-specific outcome measures. And instead of standard questions, CODI asks client about difficulties like walking, jumping, climbing stairs, descending stairs of their dogs. Scoring system is from 0 to 4. And finally, result is transformed into 0 to 100 score. The 100 presents a healthy dog. The next questionnaire is Glasgow University Veterinary School questionnaire. The assessment of the impact of the pain impact on quality of life in dogs with osteoarthritis is related to dogs' behavior. And the last one questionnaire which I wanted to present to you is Canine Orthopedic Index, COI. This questionnaire was recommended by American College of Veterinary Surgeons for assessment of the quality of life in dogs with orthopedic diseases. The next tool, which I'd like to show you, is Clinical Score. And this slide shows the clinical scoring system for assessment of osteoarthritis in dogs. Veterinarians can use this tool for recording severity of osteoarthritis, monitoring the disease, and for assessing the treatment efficacy. For example, this assessment may be based on a different criteria like specific lameness, weight bearing, joint mobility, pain of palpation, and overall score of clinical condition. And each of these criteria is graded from 1 to 5. In the right side on the slide, there is presented visual description scale from 1 to 5, the above criteria: walking, joint mobility, pain of palpation. The next slide, which I'd like to present to you, is canine osteoarthritis staging tool cost. This questionnaire is addressed for osteoarthritis evaluation of all dogs with different stages of osteoarthritis. Cost includes as well preclinical stage, but at risk for osteoarthritis development, as well as dogs with advanced obvious signs of osteoarthritis. The canine osteoarthritis staging tool is a new, validated, precise, and reliable tool for osteoarthritis diagnosis and monitoring. Cost can be used easily in first opinion practice for evaluation of osteoarthritis. This questionnaire is based on observations and assessments by owners, and they can use that for one of clinical methodology instruments like load, HCPI, and CBPI. And the next who can assessment it, there are veterinarians. The assessment is focused on evaluation of the posture, mobility of the dog, and grading the joint. The cost questionnaire consists of two key steps. The first is grading the dog. The owner evaluates the dog for a month using a clinical methodology instrument like, for example, load, and then the result can be extrapolated to cost and grading the joint by veterinarian. He assesses details like upon manipulation, passive range of motion, and radiography. And the second step is staging osteoarthritis. It's consolidation of these grades, grade of the dog and grade of the joint, and it determines the cause stage of osteoarthritis. And there are 5 possible stages of osteoarthritis from 0 to 5 to 4, inclusive 0 and 4, according to the cause system. And there are 2 preclinical osteoarthritis stages, stage 0 and stage 1, where 0 is no risk factors apparent, and 1 is at risk. At least one predisposing factor for osteoarthritis apparent, like predisposition, joint injury, obesity, intense activity, and or radiographic signs of dysplasia or joint trauma. And obtained results, the grade of osteoarthritis can help us to initiate an early osteoarthritis management strategy to prevent clinical signs developing in the preclinical dogs and reduce the stage in clinical dogs. Cause questionnaire can be used for monitoring of osteoarthritis development. In case of mismatch assessments and the difference between grading the dog and grading the joint is 2 or more grades, the joint is reevaluated, is recommended to exclude coexistent disease. Summarizing, I have to say that validated scoring systems such as COAST are comprehensive and consistent ways to assess and monitor osteoarthritis.
So it's important that we use imaging to complete our diagnosis. Radiography is certainly the most widely useful tool, and it is a very good first-line diagnostic tool. We can use it very sensitively to detect things like osteophytosis, new bone formation at the margin of a joint. But we can also pick up other aspects of the disease as well, such as synovial effusion, enthesophytosis, which is mineralization of the origin or insertion of tendons. We will see sclerosis of the subchondral bone, remembering that bone is part of the osteoarthritis process. We'll certainly identify soft tissue swelling. We can see intra-articular mineralization, which might indicate the origins of the disease, and we can look for subchondral cysts as well. But what I can't emphasize enough is that radiography is used to support the clinical examination and rule out other diseases. It is not a measure of osteoarthritis severity. That is based on the history and the clinical examination. So having more osteophytes doesn't mean to say that osteoarthritis is more severe. So imaging is not a substitute for a careful orthopedic examination. Just taking radiographs of a dog, identifying osteophytosis, does not mean that the dog is clinically affected by that disease. We have other techniques. Magnetic resonance imaging, MRI, is certainly gaining in its use, and we can provide additional information on not just the joint, so for example, subchondral bone or synovial reaction, but also on the periarticular soft tissues, which can be very important in dogs that are affected in complex joints and with the soft tissues. For example, the MR image that's present is a dog that had elbow dysplasia, but it presented acutely, and there was a profuse synovial reaction from some trigger of inflammation inside the joint. So we can get a lot of information for MRI. The problem is getting good quality images is very time consuming and very expensive. CT is used very commonly, again, particularly for complex joints such as the elbow. It's very sensitive for osteophytosis. And it's quite useful when you're looking for initiating causes such as elbow dysplasia or osteochondrosis. You may need to have other imaging modalities in complex cases, for example, ultrasound or arthroscopy or even gamma scintigraphy. It's very important when we're thoroughly assessing joints that we look at every possible cause of lameness in these dogs, such as ligament and tendon disease, and sometimes that involves other modalities. And finally, if you are considering the possibility of inflammatory joint disease, such as immune-mediated polyarthritis or infection, then always do a synovial fluid examination. You will be quite surprised how common these conditions are when you look for them, and it's really important that we don't miss them. So we might need to use advanced imaging techniques to completely assess the dog, even if you have identified the primary disease of osteoarthritis. So to conclude, diagnosing osteoarthritis, remember that clinical osteoarthritis is much more than a sore joint, and it can be obscured and complicated by other disease processes. We must remember that even if the diagnosis of osteoarthritis is straightforward, we have to be careful to fully assess the whole patient. And clinical metric instruments are useful and get the owners involved in the monitoring of their patient. We still need to look very, very carefully at our dogs at each visit to make sure that their diagnosis is correct and they're not being affected by other problems. Validated scoring systems are comprehensive and they are consistent ways to assess and monitor arthritis. Diagnostic imaging, radiographs, CT, MRI, is not a substitute for careful orthopedic examination. If you do not know where the patient is painful, what's causing the lameness, then taking radiographs may not necessarily get you to an answer. We might need to use advanced techniques, and you should consider referral in these difficult cases. Very importantly, early diagnosis requires the owners to understand the signs that may present, may indicate their patient, their dog has arthritis, and it can be very, very subtle.
And thank you very much for your attention. Have you any questions?